You know, some medical procedures are so good we basically think of them as miracles. Cataract surgery? Definitely one of them. It gives millions of people their sight back every single year. So, what if I told you scientists just finished a massive study to make that miracle even safer? That's right, today we're going to look at how you go about perfecting perfection.
And really, that's the big question here, isn't it? How do you make a miracle even better? I mean, when something already works so incredibly well, where do you even start looking for ways to improve? Well, it turns out the answer is you go after the tiniest, rarest risks, but you do it with the biggest study you can possibly imagine. Okay, so before we dive into the study itself, we really need to get our heads around just how big of a deal cataract surgery already is. Let's just set the scene a little bit. I mean, think about it. Cataract surgery is one of the most common and most successful operations in the entire world. The idea is so simple, right? The surgeon takes out your cloudy natural lens, puts in a new, clear one, and boom, the world is back in focus. It's life-changing, and it happens millions of times a year. It's truly a routine miracle.
But, and there's always a but in medicine, even with this incredible success, there's this one tiny hidden risk. It's rare, but it's devastating. We're talking about a postoperative infection. It's this tiny chance that this miracle can turn into an absolute nightmare, threatening the very sight that was just restored.
So let's talk about this post-surgery threat. What exactly is this tiny but terrifying villain of our story? Well, to figure out how to beat it, researchers had to really understand what they were fighting.
Okay, the fancy medical name for it is endophthalmitis. Basically, it's a serious bacterial infection inside the eye. And while it's super rare, the consequences are, well, they're severe. It can lead to serious vision loss or even blindness. This is the one thing every surgeon is trying to prevent. You could almost call it the final boss of cataract surgery safety.
And for years, surgeons were kind of all over the map on how to prevent this. Should they use antibiotic eye drops? Should they do an injection? Which one? Some people even argued for doing nothing at all. The problem was there was no single definitive rock-solid piece of proof that said this is the best way. And to get that kind of proof, you need to go big. You need an experiment on a truly epic scale.
Which brings us right to the heart of our story today. Let's talk about this massive experiment.
Yeah, 60,000 eyes. Just let that number sink in for a second. That is the incredible scale we are talking about here. This was a huge, multi-center, randomized controlled trial. Now, that's a mouthful, but what it means is that this was the gold standard of scientific studies, designed from the ground up to eliminate bias and get the clearest, most trustworthy answer possible. This was no small thing. It was a monumental effort.
And you know what's so great about the study design? It's just beautifully simple. Here's how it worked. All 60,000 eyes got the exact same top-notch cataract surgery. No difference there. The only change was at the very end. Half the patients, that's our case group, got a tiny little injection of an antibiotic called moxifloxacin right into the eye. The other half, the control group, got nothing. And then they just watched and waited to see what happened.
And I just want to point out, this wasn't some quick weekend project. We're talking about a research period that lasted over 6 years, starting way back in 2018. They just wrapped up data collection in 2024, and the results are fresh off the press. That kind of long-term work is what makes the findings so solid and trustworthy.
All right, so 6 years, 60,000 eyes. The big question is, what did they find? This is the moment we've been waiting for. Let's get to the results.
So, did the injection actually make a difference? Was this whole massive multi-year effort worth it? Did that one tiny little step at the end of surgery actually stop that awful infection?
And the answer is a huge, unambiguous yes. The data could not be clearer. Okay, look at this. In the group that didn't get the injection, the infection rate was 0.05%. But in the group that did get the antibiotic shot, that rate dropped all the way down to 0.02%. Now, in science, when you see a difference like that, you call it statistically significant, which is basically code for, wow, this is the real deal. This is not just a fluke. It's a major, major breakthrough.
Let me put that a different way, because this is the key takeaway. That one simple injection made the surgery about 2.5 times safer from this one specific, really awful infection. That's not a small improvement. That is a giant leap forward for patient safety.
Okay, so we know it works. That's part one. But in medicine, there's always a part two, and it's just as important. Is it safe? I mean, you're injecting something directly into the eye. Does that cause any other problems? Because the last thing you want is to fix one issue just to create a brand new one.
And this is where the study just gets even more impressive, because they checked everything. They looked at the delicate cells on the cornea, no damage. They checked for swelling in the cornea, nothing. Most importantly, they found no cases of a nasty complication called TAS and no other serious inflammation or side effects. So the bottom line is, the treatment wasn't just effective, it was proven to be incredibly safe.
So, let's just recap. We have a treatment that a massive study has proven is both safe and effective. So what does this actually mean for the future? Where do we go from here?
Well, here's what makes this so powerful. This isn't just a result from a controlled study. It's actually backed up by real-world data. We're talking about data from the Aravend Eye Care System, one of the biggest eye care providers on the planet. They looked at over 3 million surgeries, and guess what? They saw the same super low infection rates. So we know that what worked in the trial works out in the real world, in everyday clinics.
And for the surgeons themselves, this is a total game changer. See, a lot of other antibiotics have to be mixed and diluted right there in the operating room. And anytime you're mixing stuff, there's a risk of getting the dose wrong or, even worse, contamination. But this stuff, moxifloxacin, it comes pre-packaged, it's preservative-free, and you can use it straight out of the vial. It's just simpler, it's faster, and it's a whole lot safer.
So, when you boil it all down, what have we learned? It's that a simple, safe, easy step can make one of the biggest miracles in modern medicine even more miraculous, even more reliable. This study isn't just the suggestion. It sets a whole new gold standard, and it's backed by an unbelievable amount of evidence. And it really makes you wonder, doesn't it? What other procedures that we think are already perfect are just one massive study away from their own huge leap forward?